contributed. Anyway, this is Stan, and welcome to the Good Program.
I want to be accused of misrepresentation. Hello everyone, it's great to be here in beautiful Sydney. It's an honour to be presenting to an enlightened audience as you are. At Otago Dental School in the 80s, I was told that water fluoridation reduced tooth decay greatly. And I always held that opinion without really being able to justify it, except to quote some early studies that I was taught, and to have the warm fuzzy feeling that it was endorsed by the Dental Association. A couple of years ago I decided to look at the evidence in person, as I thought my opinions should be based on evidence rather than endorsements. Water fluoridation is all about reducing tooth decay. There's no other reason to be doing it. But how do we know that it's working? Decades of research in this area has been unreliable due to poor design and bias. But as the saying goes, the proof of the pudding is in the eating. So what benefit are we seeing in today's communities? The New Zealand data gives us an opportunity to look at communities with and without water fluoridation and quantify the level of benefit in real life. I will look at decay trends, current New Zealand data, interpretation of statistics, and how it stacks up with our current understanding of how fluoride works. And just to stress, I in no way represent the opinion of the New Zealand Dental Association, or probably the majority of dentists in New Zealand who have opinions, but continuing. This Christmas I went on a road trip up the central North Island. I happened to pass through Hastings and came across this cheerful group of citizens on the roadside. I'm pictured there with them. I stopped to ask what was happening, and they said they were celebrating their new fluoride-free water tap, pictured there, which their council had installed to cater for the residents who didn't want fluoridated water. Hastings was the first New Zealand town to have their drinking water topped up with artificial fluoride back in 1954 as part of a human trial, and many citizens have been struggling with it ever since. So these guys were happy because now the 40% of the people in Hastings who don't want fluoridated water coming out of their taps just need to hop in their car, drive across town with a few plastic bottles, join the queue, fill them up, drive back home, and then they can make their brew, boil the spaghetti, or perhaps even brush their teeth. I hope you're understanding the New Zealand accent. Yes. Yeah. Good luck with the cricket, by the way. I can understand if these people were a bit peeved at having to go to such an effort, especially considering that after 60 years of fluoridation, the dental condition of Hastings residents is no better than those of neighbouring Napier 10 kilometres up the road, which has never been fluoridated. So it's reasonable to ask the question, how much benefit do we get from fluoridating the water? The most trustworthy review of the scientific evidence was the York review conducted for the National Health Service in the UK and published in 2000. It found that there was a 15% reduced incidence of decay in fluoridated areas. They found that the research, however, was generally of a very poor standard of reliability. Out of 3,500 studies, they only considered 26 were up to scratch. And it emphasised that the findings could be inaccurate due to poor controls for bias and dental age. New Zealand and Australian research since then have similarly failed to control adequately in these areas and seem to lack objectivity. Efforts are currently being made to set guidelines for oral health research to overcome the lack of transparency, bias and misrepresentation which has been occurring in this field. It is to be hoped that New Zealand and Australian dental schools will comply with such guidelines. One study which does follow the York Review requirements for reliability, which Paul mentioned earlier, was the Iowa study in the United States, which was a longitudinal study with a sound design. It finds that tooth decay is not related to fluoride ingestion, and there is no benefit from water fluoridation. The same level of benefit, none, was demonstrated by the largest US study of school-aged children, as reported by Yanis. Tooth decay has dropped dramatically in recent decades, as shown on this graph of the average number of decayed, missing and filled teeth in 12-year-olds, with the blue line representing the New Zealand data since 1960. This is mirrored by the Aussie data in green underneath. The drop corresponds with the start of water fluoridation. And enthusiasts might jump to the conclusion that a large drop in tooth decay is because of water fluoridation, and in fact many do. Some even climactically proclaiming it one of the greatest public health measures of the 20th century. But there are some glaring flaws in this cause and effect theory. First of all, the reduction of tooth decay with time, shown by the red arrow, indicates that the drop has not occurred just in fluoridated areas alone, but must have also happened in unfluoridated areas, considering that only 50% of New Zealand has ever been fluoridated. The second bug in the ointment is that the decay levels have been dropping in New Zealand at the same rate since the 1930s, well before water fluoridation was implemented, as shown in this graph by the late Dr. John Colquhoun. In fact, we can see no difference in the rate of decline after the introduction of water fluoridation to half of the country. The third bug in the ointment, actually it's an elephant in the room, and you've seen versions of this graph earlier, is that tooth decay around the world has dropped just as much or more in countries which do not have water fluoridation. In this graph we can see that the decay has dropped no faster in New Zealand and Australia than in countries with no water fluoridation such as Germany, Japan, Denmark, Netherlands, Sweden and Iceland. Here, countries are ranked according to DMFT in 12-year-olds, with Denmark at the top having the best figure of 0.7 of a tooth affected by decay by age of 12. And down the bottom, we see Norway with 1.7 teeth. Only a handful of countries fluoridate their water, and this is shown in green, with the amount of green representing the proportion of the population in each particular country with water fluoridation. The only country with mandatory water fluoridation, Ireland, ranks 10th. Australia, with 80% fluoridation, is 8th, and New Zealand, with 50% fluoridation, comes in at 18th out of 20. Note that only one country out of the top 7 used water fluoridation, England, which is only 10% fluoridated. A few countries use salt fluoridation, shown proportionately in green. Salt fluoridation is cheaper than water fluoridation and does not undermine human rights in the same manner.